Hello all, my name is Shay Degnan, currently enrolled at National University's Masters in Public Health with a concentration in Healthcare Administration program. The health behavior topic that I will be discussing is increasing physical activity and how it can lead to some problems such as cardiovascular disease, diabetes, obesity, risk of colon cancer, high blood pressure, osteoporosis, depression, anxiety, and other psychological problems. Today, it will mainly focus or involve cardiovascular disease, obesity, and what it means to be sedentary. Finding collective of information, what it could mean for someone who does make the health behavior change, or for those who do not. Living in a sedentary lifestyle does no good for anyone as they are to make changes to avoid the risks previously listed. I use the health behavior model to help process and motivate someone to make this health behavior change as part of understanding it and a changeable task. What the physical activity standard means according to the CDC is exercising for a minimum of 30 minutes of moderate exercise for 5 days a week, or vigorous for 20 minutes 3 times a week. Countries that are developed and countries that are still developing, there are 60 to 85% of people who are living a sedentary lifestyle around the world. One of the populations at risk are children that are living the sedentary lifestyle, which will affect the health of their future. Another population at risk are those who are asked to work in front of a computer and to complete their tasks on a computer, leading to sitting down for roughly 8 hours a day rather than moving around. In addition, having a desk job increases the health risks by 50%. There are other factors that can lead to cardiovascular disease, and one of those is being obese or overweight. Part of the concern of also living a sedentary lifestyle or not participating in the physical activity standard provided by the World Health Organization or the CDC. In an article where research of using volunteers of those who are at normal weight, overweight, and obese, they found out that the exercise program has benefited the cardiovascular system by reducing the blood pressure in the overweight participants. The concern the team had was the nutrition portion that still saw levels of cholesterol did not change. Although that is another topic for discussion, you can still see the effect the nutrition has with being overweight, as physical activity is part of the problem, but not the whole solution. So if you're not getting as much physical activity, it won't help you, but at least doing something will help reduce the risk of getting cardiovascular disease and can also help with weight and obesity. We know some of the factors, such as living a sedentary lifestyle. If you work at a desk in front of a computer where your tasks have to be completed, nutrition. We also know that not having physical activity as part of your lifestyle, it can contribute to the higher risk of cardiovascular disease and obesity. As we now look to use the health behavior model as a way to change the sedentary behavior to increase physical activity. The health behavior model includes 6 constructs that help make this health behavior change possible. This includes perceived susceptibility, perceived severity, perceived benefits, perceived barriers, cues to actions, and self-efficacy. Perceived susceptibility is the belief about the likelihood of getting a disease or condition. For our topic today, cardiovascular disease or obesity. If you know that you do not get the physical activity that you need, you are at risk for many illnesses or disease. You are at a point of understanding your surroundings and what makes you at risk for this illness or disease. Perceived severity is the belief about the seriousness of getting the illness, disease, or not doing anything about the sedentary lifestyle with a lack of physical activity. This also includes physical consequences and social consequences. If you have to lose a limb because you're diabetic by sitting around all day and not having physical activity, or you feel that you're overweight and you may not want to hang out with your friends because you may not fit in. Perceived benefits are the positive outcomes of increasing physical activity as your health behavior. We look at reducing the risk of cardiovascular disease, could lose weight because you're overweight or you're obese, you start losing weight. You may even feel more confident in yourself, where you may not feel stigmatized. Perceived barriers is the belief regarding obstacles to make the change to increasing physical activity along with the negative aspects. This includes the cost of going to the gym, where you may not be able to afford because of the monthly costs or sign-up fees, which leave you in a bind because you enjoy using the weights as part of your physical activity. Another could be the closest gym is an hour away from you, and that's not convenient for anyone. Or it could be psychological if you're walking outside for exercise and you may not want to because people stare at you just because of the way you look. Cues to action are almost like post-it notes for you to start making the action of increasing your physical activity. For instance, everyone has a phone. Set a reminder to walk today or tomorrow. Go for 30 minutes or set 2 15-minute reminders. Either way, this is to process you to be like, hey, I should go exercise. Excuse me. The other could be internal, where you're not having enough energy for the day. And, if you start exercising, it'll help you in the long run for your energy. The cues could also be external, where you're going to your physician and they say, Shay, we may need you to go and make exercising as part of your everyday lifestyle. And that's telling you, all right, now I need to go exercise. Leading to the self-efficacy is the belief that I can get the job done, making the health behavior change and setting goals, or telling yourself, you're doing an amazing job, getting advice from someone you may know, or even from the gym that you've been going to. Getting the confidence to increasing physical activity is key to making the health behavior change. And as part of helping the solution is you need a plan to change the health behavior. Start with what's your identity of physical activity. Does that mean competing? Do you want to be an athlete? Do you want to use physical activity as part of a social experience? Set up a day or two a week or once a week, part of your physical activity program. Play kickball or volleyball, things of that nature. You have to understand what physical activity means to you. And by doing so, you help plan your schedule based on that. So you know what you have to do to make that change to reduce your health risk. I want to thank you for listening. Appreciate your time. Shay.